Hello, my name is Dr. Sylvia Ramirez. I'm a Harvard-trained medical and scientific director of Cutis Medical Laser Clinics. Let's first talk about how your skin will age over time. The top of the skin is known as the epidermis, can develop pigmentation because of sun exposure and hormone changes. The second layer of the skin is where we lose collagen, and when this happens, our skin becomes lax and sagging. Under the skin is the muscle layer. With facial expressions, we create creases of the skin and expression lines of wrinkles. And under the muscle, we lose fat and bony tissue, resulting in loss of contour, shape, and support of the face. Altogether, these can make us look tired or sometimes older and sagging. The great news is there are many treatments we can do to reverse many of these changes that happen over time. Patients nowadays are very sophisticated. They would have read about various treatments and looked at various concerns on their own. So most of the concerns entirely depend on the age of the patient. Younger individuals tend to be very specific. They ask about treatments for pigmentation or specific wrinkles, or they look to enhance various features on their face, such as the nose or the chin areas. In contrast, patients older than 40 years of age will often have broader or more general concerns with aging. Examples would be wanting to look refreshed because they feel they look tired, or worried about sagging or laxity and wanting to regain a sharper jawline. Both cases, both young and old, sometimes will come with concerns about body shaping or contouring. And this is a very common complaint, especially nowadays as patients are becoming more active and have a healthy lifestyle. When a person comes with a concern of sagging or laxity, we first need to understand what is happening to that patient's face. Often, there's a component in which it is skin because of collagen loss that happens starting in our 20s, in fact. By 40 years of age, we make less collagen than we build. So we need to think about ways to stimulate collagen in the deeper layers of the skin. The deepest treatment available today that is non-invasive is a procedure known as ultherapy. This uses ultrasound waves to stimulate collagen building in the deeper layers of the skin without needles or injections, and it doesn't even have a downtime. Another way to stimulate collagen building and reposition our tissues is using threads. Threads nowadays use polydioxanone or PDO threads. These are carefully inserted into the skin to cause a lifting and pulling effect as well as collagen building. In the majority of patients, there's going to be a very important component of volume change. We know that as we get older, we lose volume in certain fat pads on the face. This can happen in the under eye area, resulting in hollowing, the cheek area, and when the cheek volume is reduced, we have exaggeration of what we call the nasolabial folds, which is a very common concern among patients. Finally, when you lose volume on the cheek, as well as bony changes in the jawline area, there's loss of definition of the jawline, which contributes to laxity and sagging appearance. Because of these volume changes, we would need to correct the volume loss by the insertion of carefully placed dermal fillers. Dermal fillers are administered in a very safe and natural way. There are many types of these fillers. One may be hyaluronic acid fillers. Hyaluronic acid is a substance that's already in our skin. There are many examples of these types of fillers. But the great thing about hyaluronic acid fillers is that our body recognizes this as our own tissue, and we break them down over time. Other types of fillers may be made of calcium. Calcium fillers are biostimulators, so not only do they replace our volume change, but they also stimulate collagen building. One of the most common concerns of our patients is looking tired, and they really like to look refreshed. Treatments for looking tired may include injection with botulinum toxin. There are many brands of this, But sometimes light injections of Botox, which is a brand of botulinum toxin, may result in opening of the eye area and less crow's feet. Sometimes we need to put fillers because as we get older, our eyes become hollower, and because of loss of volume on the under eye area as well as on the cheek area, this may look pulled down and make us look tired. So gentle injection with dermal fillers on the cheek area and the under eye area can instantly make us look refreshed. Finally, sometimes we need to improve the quality of the skin in the under eye area because it is baggy from loss of elastin and collagen. This is where we introduce lasers and light as well as laser resurfacing procedures to renew the skin and make it tighter. Altogether, this can then result in a very natural, refreshed look, really without surgery. If you'd like to find out more how to reduce your age-related concerns in order to look refreshed in a natural way, please don't hesitate to reach out to us. I'd be happy to go through a detailed consultation with you to explain what treatments might be suitable for your concerns. Thank you.